Good day, fellow learners, and in this video, I'd be highlighting some important concepts that I'd like you to remember when you're taking your NCLEX RN on the topic insulin. Okay, now why do we have to study insulin? Well, for a very simple reason, because diabetes mellitus is one of the most common causes of morbidity in the United States and in other countries in the world. That's why, since insulin is usually a mainstay in the management of diabetes mellitus, whether you have type 1 or type 2 diabetes, then it's very essential for us to master concepts related to insulin. So let me begin our discussion with this question. What is insulin and what role does it play in our body? Now, I'd like to answer that question before we proceed with our discussion. So insulin is actually a hormone. It's produced by the beta cells in the pancreas. What role does it play in our body? Actually, insulin is responsible for helping glucose enter the cells such that it maintains the supply of glucose to the body cells, which will in turn use it as body fuel for production of energy. Now, what happens when there is excess glucose in the body? Now, upon the action of insulin, the liver would usually store the excess glucose in the form of glycogen. Okay? Now, to make things more simple, sometimes technical definitions would not help us because when we're taking the test, remember, everything that we have learned, including technical terms, may become difficult for us to remember, honestly. And the moment you sit in front of the computer when you're about to take the test, okay, your mind could actually sometimes go blank as if there's nothing that you have put in there from your test preparations classes. But you know, if you learn something in a fun way, is one thing that I learned when I was doing my master's in the US, it kind of sticks in your mind. Okay, so I'd like to simplify the role of insulin as it relates to glucose and the body cells in a story, okay? Or shall I say, we make use of a metaphor. Okay, so suppose you have here a car with all the grocery supplies that you have at the back, and then you have the house, and in the middle, you have the key. So we consider the groceries as sugar or glucose. And then we consider the house as your body cells. Now the question is, so how can your body cells utilize the sugar and transform it into its fuel in the form of energy? Okay? If your sugar may not be able to enter the house. So to do that, you need to open the house using a key, okay? And your key, okay, is the symbol that represents your insulin. Therefore, insulin facilitates the entry of sugar to the body cells. So it's as if, how do you bring in your groceries to the house such that the people in the house, meaning the body cells, would be able to eat and be energized. So that's how simple as it could be. So you have the grocery items, okay, as your sugar, the house as your body cells, and the key that facilitates the entry of the groceries to the house, your insulin. Okay? I just hope you like this metaphor. It took me quite a while to put this illustration together. Okay, so let's try answering a sample question. Let's see whether that simple knowledge that we just learned would be enough for us to be able to answer questions that pops out of our computer screen. Here's an example. The following 4 patients received their insulin at 7 a.m. Which patient should the nurse consider as a priority for blood sugar testing? Now, the key word in the stem of the question is the word priority. So which client would you need to check the blood sugar first? Is it client in option 1, a 40-year-old with type 2 diabetes who received 20 units of NPH insulin? Option 2, a 30-year-old with type 1 diabetes who received 10 units of Insulin List Pro? Or option 3, a 60-year-old with type 1 diabetes who received 10 units of Insulin Glargine? Or option 4, a 50-year-old with type 2 diabetes who received 20 units of Humulin N? Now, this is where the hard work begins. Okay, when you are dealing with this type of question, you have to pay particular attention to which aspect. Is it the age of the patient? Is it the type of diabetes? Or is it the type of insulin? The answer is actually in one of those statements I just made. So when you're trying to determine who among these patients should be your priority for blood sugar testing, we need a working knowledge on the types of insulin. We are going to go back to this question after we go through all the different types of insulin, and I'd be highlighting the things that I'd like you to remember for your test, okay? So reminder, to receive a PDF file of the essential aspects of this presentation, send us an email at this address, mentor.raygapuz@gmail.com. Now let's begin with the functional concept. Okay, according to the National Institute of Diabetes and Digestive and Kidney Diseases, the expected sugar levels are related to a patient's mealtime as follows. Just before eating, the blood sugar level should be between 80 to 130 milligrams per deciliter, and 2 hours after a meal began, it should be below 180 milligrams per deciliter. Why is this important? Because the level of sugar, okay, from the monitoring you've done to your patient determines the amount of insulin that they would need, okay? So here's a question. Why are timely insulin administration and blood sugar monitoring important in patients with diabetes mellitus? Here's the answer. Because there are certain conditions that could potentially occur in patients with diabetes. And these conditions could be addressed by the administration of the proper amounts of insulin at the most appropriate time of the day. Okay, so one of these conditions would be your Somogyi phenomenon, and it's characterized by rebound hyperglycemia that occurs at night. So in Somogyi phenomenon, what happens is that maybe before sleeping, you've had too much exercise, okay, or you didn't take snacks while exercising, or you increase your insulin dosage before sleeping. So what happens is, as the blood sugar goes so low, so the body would compensate, and in essence, would cause rebound increase in sugar levels. So that's what we call rebound hyperglycemia. Okay, so if this rebound hyperglycemia occurs at night, it's called Somogyi phenomenon. Now, dawn phenomenon, as the term implies, it could potentially not necessarily occur at dawn, but early in the morning. So dawn phenomenon is characterized by hyperglycemia in the morning, and it's usually caused by hormonal changes in the body. Because at dawn, okay, with the increased secretion of growth hormones, there's usually a hyperglycemic effect that occurs with the secretion of growth hormones. So therefore, we expect the blood sugar levels to go up, okay? So if we're going to compare the two, let's highlight. Somogyi phenomenon is hyperglycemia that occurs at nighttime. Dawn phenomenon is hyperglycemia that occurs early in the morning. Now, whether you have Somogyi phenomenon or dawn phenomenon, what you have is actually a hyperglycemic state. Now, the question is, how do we define hyperglycemia? Now, remember 3 values for this concept. The first would be if the patient's blood sugar level is from 100 to 126 milligrams per deciliter, or 5.6 to 7 millimoles per liter. This is classified by the American Diabetes Association as slightly hyperglycemic state. Okay? Now, when the sugar level is above 126 milligrams per deciliter or above 7 millimoles per liter, then it's now considered as suggestive of diabetes mellitus. Okay? Now, can a patient with diabetes, with those levels of glucose, already manifest signs and symptoms of hyperglycemia? Well, according to the American Diabetes Association, the signs and symptoms of hyperglycemia usually occur when the sugar level of the patient goes up to 180 milligrams per deciliter or more than 10 millimoles per liter. And when we speak of hyperglycemia, you have the three P's. You have polyuria, polydipsia, polyphagia, and then you have accessory symptoms like fatigue, headache, and of course, blurring of vision. Okay? So once again, whether we have a Simogi phenomenon or a Dawn phenomenon, then we have a hyperglycemic state. Okay? Okay. Now, tobacco smoking aggravates insulin resistance. Okay. Now, what do we mean by the term insulin resistance? When we say insulin resistance, this is when the body cells do not respond properly to insulin. So, if you're going to go back to the illustration that we had a while back, okay, remember that insulin facilitates the entry of glucose or the groceries into the house or our body cells. So, in insulin resistance, the body cells does not respond to the action of insulin. So even if insulin, okay, has been knocking on the door, the body cells still remain closed. So that's what we term as insulin resistance. Now let's discuss. Let's begin. Now let's discuss the different types of insulins, and let's begin with the rapid-acting insulin, okay? So we have examples. You have your List Pro or Humalog. You have your Aspart or Novolog, and Glulicin or Apidra. Now, pay particular attention to this important thing. Any of these three, List Pro, Aspart, and Glulicin, would have an onset of action of less than 15 minutes. So less than 15 minutes could mean 5 minutes, 10 minutes, okay? So the onset of action signifies the time in which the insulin begins to take effect, okay? The peak of action, on the other hand, refers to the time in which the insulin would exert its strongest effects. And for your rapid-acting insulin, okay, you have 60 to 90 minutes for your List Pro and Glulicin, and 60 to 120 minutes for Aspart or Novolog. Now, the duration of action for List Pro is 3 to 5 hours, same as that for Aspart, and 1 to 2.5 hours for Glulicin. Now, for you to be able to remember the onset of action, the peak of action, and the duration of action, we need to code this, because this is an essential thing for you to remember when you're about to take your test. So let's turn this into a code. How do we do that? Maybe we could use dates, okay? So what are the things that you have to know? Definitely the onset of action is an essential concept. The peak of action, because at this point in time, you expect hypoglycemia to occur, okay? And then the duration of action is also important, because you would have to know when the effect of the insulin could be waning off, okay? So to code that, we cannot memorize this singly. So we have to code it. And we say, for rapid-acting insulin, maybe you can use 15, and then you can use 60 minutes, and then 3, because 1 to 2.5 is also near 3 hours. So we could do like our code, 1563. So for rapid-acting insulin, remember 1563. meaning the onset of action would be in 15 minutes, peak of action 60 minutes, and duration of action average of 3 hours. So 1563, okay? I'd show you how to use this coding in a while. Now, let's move on to a functional concept. Rapid-acting insulins are usually administered 15 minutes before meals. Insulin List Pro may take effect in as early as 5 minutes. Remember, this is less than 15 minutes, okay? The onset of action. Now, let's have a framework before I discuss Insulin List Pro. So among the three rapid-acting insulin, I'd like to highlight Insulin List Pro. But for us to be able to recall what are the concepts that we need to remember related to Insulin List Pro, we have to have a framework so that we know what are the things that we are supposed to learn. Now, when we're talking about drugs, there are 5 things I'd like to emphasize, and this is contained in the acronym CHECK, okay? So the first is, you have to know the classification of the drug. The second is, you have to know how to evaluate the effects of the drug. How can you tell that the medication is taking its desired effect? You have to exactly know what time it is best to administer the drug. And then you have to know your client teaching tips related to the administration of the drug. And of course, the most important thing, you have to know the keys to safe administration of the drug. What are the things or the laboratory data that you need to check before administering the medication? You have to know drug interactions also, okay? So let's apply the CHECK framework to Insulin List Pro. So Insulin List Pro is a rapid-acting insulin, as we said a while back. So the onset of action could be less than 15 minutes. How will you know that it's effective? You have reduced blood sugar levels, okay? And your List Pro does that by stimulating glucose uptake by the skeletal muscles. Exactly what time do you have to give it? It's 15 minutes before meals or immediately after a meal. It's given either subcutaneously or IV, never IM. Then it has to be refrigerated, but do not freeze. Protect it from extreme heat and light. And then once opened, store for a maximum of 28 days at below 86 degrees Fahrenheit temperature. Side effects, we expect hypoglycemia, which is most common, and of course, hypokalemia, because insulin would actually cause potassium to enter the cells, thereby decreasing the potassium in the blood. And if you may want to recall your ECG pointers, in hypokalemia, you have your pathologic U wave, okay? And then, keys to giving it safely, never mix with any type of insulin while contained in the cartridge, okay? So if it's contained in the cartridge, you never mix it with any type of insulin. But upon the advice of the physician, it is mixed with NPH insulin only when there's a need for manual mixing of insulin from a vial, okay? We're gonna talk about how to manually mix insulin in a separate part 2 of this video. Then when using a pre-filled pen, take it out of the refrigerator 1 hour before use. You do not immediately administer cold insulin. That could actually lead to lipodystrophy, okay? Now, let's identify our functional concepts. So the first one, a blood sugar level below 70 milligrams per deciliter or 3.9 millimoles per liter may indicate impending hypoglycemia. And early signs of hypoglycemia include, remember, faint. So fatigue and hunger, anxiety, irritability, numbness of the lips, tongue, and cheeks, and tingling sensation. Okay, so if the patient exhibits any of this, it could be that the patient is having hypoglycemic reaction in relation to the insulin that was administered. Okay, now what are the warning signs of worsening hypoglycemia? So remember, worsening hypoglycemia leads to, remember, the 4 Ds. Decreased levels of consciousness, difficulty in problem solving, drowsiness, and decreased visual function. In this case, okay, it's very important that you need to check the glucose levels of the patient, because not everyone, okay, who would have decreased levels of consciousness could be suffering from hypoglycemia. Remember, decreased levels of consciousness could also occur in diabetic coma, which is actually a hyperglycemic state, okay? Now, our intervention would actually depend on the sugar level of the patient. So priority interventions to treat hypoglycemia depends on the blood sugar levels of the patient. So if the blood sugar level is less than 45 milligrams per deciliter, but the patient is conscious, then we administer 8 ounces of juice. Now remember, simple sugar could be your juice. Your chocolates are considered complex sugar, and these are not effective for interventions for a hypoglycemic state because it takes quite a while before they are metabolized and can be used by the body to stabilize the sugar level. Okay, so what about if the sugar level is between 45 to 59 milligrams per deciliter? Then we administer 6 ounces of juice. And if the sugar level is 60 to 70 milligrams per deciliter, then we administer 4 ounces of juice. So take note, the higher the sugar level of the patient, the less amount of juice that we need to administer. So it's very important that we know the sugar level of the patient. Now, on the other hand, if the patient's blood sugar level is less than 70, and this time the patient is already unconscious, that's the time that we have to administer your D50, 50 ml over 2 to 5 minutes intravenously. Okay? So what's the difference between the utilization of juice and your D50 that is administered per IV? Would definitely be on the level of consciousness of the patient. So we administer the juice if the patient is conscious and therefore is able to swallow. But if the patient is already unconscious and unable to swallow, then we have to administer 50 ml of D50 per IV over 2 to 5 minutes. Okay, food that may help increase blood sugar includes your bra, banana, raisins, applesauce, and pineapple. So actually, this food could stay longer, okay, in the GIT, such that the sugar level becomes a little more sustained. So we could actually recommend that if a patient who is prone to hypoglycemic reaction would need snacks, they could actually have banana, raisins, applesauce, or pineapple as their snack. Now let's talk about your short-acting insulin. And examples could be your regular Humulin R, Actrapid. Now take note that the onset of action is actually 30 to 60 minutes. The peak of action for regular Humulin is 2 to 5 hours and 1 to 3 hours for Actrapid. The duration of action is 6 to 8 hours for Humulin R, regular, and 8 hours for your Actrapid. Now, once again, we need to code the onset, peak, and duration of action of your short-acting insulin. And our code would be, let's take 30, and then here, let's take 2, because 2 hours could be the onset for the peak of action of regular insulin. And it's actually midway to the peak of action of your Actrapid. So we can use 2. So that's 30, 2. And then since 8 is actually the duration of action for both, okay, so we can use it. So our code, therefore, for short-acting insulin would be 30-8. Remember, for rapid-acting insulin, it's 1563. For short-acting insulin, we have 30-8. Okay? We will use our code later on. Okay. So once again, for rapid-acting insulin, 1563. Okay? Close your eyes and remember, short-acting insulin, the code is 30-8. Okay. Now, the American Diabetes Association recommends regular insulin by continuous IV infusion for treatment of hyperglycemic crisis, diabetic ketoacidosis, hyperglycemic hyperosmolar state, and hyperkalemia. Remember that concept. If it so happens that you'll have a multiple choice with multiple response or SATA question, then this could be a potential concept. Okay? Now, from between the two examples of short-acting insulin that we've identified, Humulin R and Actrapid. So let me highlight Humulin R using our check framework. So it's a regular or short-acting insulin. The onset of action is actually within 30 minutes, okay, 30 to 60 minutes. It is effective when the blood sugar goes down to the normal levels. It is usually given 30 minutes before meals or depends on the prescribed dose and frequency. It's given sub-Q or IV and can be safely used during pregnancy and breastfeeding. The side effects would include hypoglycemia, lipodystrophy, and hypokalemia. Now, if administered IV, it is not mixed with any insulin. If administered subcutaneously, it can be mixed with NPH insulin, okay? So take note, if it is administered per IV, it's not mixed with any insulin, but if it's administered subcutaneously, it can be mixed with NPH insulin. Now, this time, let's talk about your intermediate acting insulin. And our examples, you have Humulin N, NPH or isophane, and Lente. Once again, the onset of action, okay, for Humulin, it's going to be 1 hour. So once again, the onset of action for Humulin is 1 hour, and for NPH and Lente, 1 to 2 hours. The peak of action for Humulin is 4 to 10 hours, and for its duration of action, 16 to 18 hours. For NPH, the peak of action is 4 to 12 hours, and for Lente, the peak of action is 4 to 10 hours. For the duration of action for NPH, 16 to 24 hours, and the same, 16 to 24 hours for Lente. Now, once again, let's code this. For intermediate acting insulin, this is easy to code. So you have similar numbers like 1, and then 4, and then 16. How do we remember these things? So all we have to do is to 1, and then get the number 1, and then get the number 4. Okay? So what we do is we create a code and we say 1 times 4, and 4 times 4 would give you 16. So the code therefore would be 1 times 4 times 4. So the onset of action is 1 hour, the peak of action is at least 4 hours, and the duration of action would be times 4 times the peak of action. So 4 times 4 is going to be at least 16 hours. So the code for intermediate acting insulin would be 1 times 4 times 4. Once again, our code for rapid acting insulin would be 1563. Our code for short acting insulin would be 328. And our code for intermediate acting insulin would be 1 times 4 times 4. Okay. So let's move on. Okay, so among the 3 intermediate acting insulin that we identified, let me highlight your NPH insulin using our check framework. So it's an intermediate acting insulin. The onset of action is actually within an hour. It is effective when you have reduced blood sugar levels to normal levels, exactly given as prescribed, because sometimes it's given in combination with a shorter acting insulin. It can be safely used during pregnancy, and it is evenly cloudy or milky, okay? So normally it is evenly cloudy and milky. Do not use if it appears frosty or when clumps of white materials are formed. Now, what are the common side effects? You have hypoglycemia and hypokalemia. So remember, you don't shake your insulin because the bubbles that could form may interfere with the amount as you aspirate it using your insulin syringe. So do not shake your NPH insulin. To mix the medication before use, gently roll the vial or cartridge upside down and right side up 10 times. And then do not rub or massage the injection after administration of the insulin, okay? Then it can be used alone or in combination with a shorter acting insulin. Next, let's talk about your long-acting insulin. So you have your Glargine or Lantus. The onset of action is 2 to 4 hours. Now the peak of action, it's usually peakless. So initially they think that your long-acting insulins may have, like for example, Ultralente will have peak of action in 14 to 18 hours. But recent literatures have identified that your long-acting insulin actually is peakless, okay? So in other words, the strength, okay, could be from the beginning of the onset of action until the duration of action. So it doesn't have a peak time, okay? And then the duration of action is usually 20 to 24 hours. So detimir, the onset of action is 1 to 4 hours. Peak of action is also peakless. And of course, the duration of action is 24 hours or more, okay? Now, what is our code? Once again, the onset of action would be, we take 4 hours, and since it's peakless, we put 0. And since the duration of action, the longest is 24 hours, so we take 24. So our code for long-acting insulin would be 4024. So the onset would be, remember, 4 hours. Since it's peakless, the peak of action would be 0, and duration of action would be 24. Once again, let's integrate. For rapid acting, 1563. For short acting, 32.8. For intermediate acting, 1 times 4 times 4. And for long acting, 4024. Okay, great. So let me highlight Insulin Glargine in our list of long-acting insulins. So it's a long-acting insulin for type 1 diabetes in adults and children, and type 2 in adults, okay? How would you know that it's effective? Of course, you have reduced blood sugar levels to the normal levels. And exactly what time is it given? Once daily, usually at bedtime. Preferably it should be given at the same time every day. But that doesn't stop. Some doctors prescribe this to be given in the morning for as long as it's given consistently. But usually it's given at bedtime. So client teaching, limit alcohol beverages, consult physician if taking herbal supplements. Again, it doesn't say avoid, it just says limit. Okay, so side effects, there could be confusion, irritability, nervousness, dizziness, which could be associated with hypoglycemia. And then you have unexplained weight gain, edema of the arms, legs, feet, and ankles, and lipoatrophy. So keys to giving it safely, taking it with beta blockers may lead to blood sugar fluctuation. So if you have a hypertensive patient who's taking a beta blocker, then you will have to inform them that they need to check on the sugar levels if they are taking insulin glargine. And then taking it with fluoxetine and monoamine oxidase inhibitors may worsen hypoglycemia. Okay? Now, time for our functional concepts. The first one, insulin glargine can be administered anytime during the day, but it should be taken at the same time each day. That's according to the American Diabetes Association. Insulin glargine is not mixed with other types of insulin, but it can be used in combination with short-acting insulin. I'd like to clarify this. We have to differentiate between the words mix and in combination. When you say mix, you put 2 types of insulin together. And when you're using insulin glargine, that is not done. So we administer insulin glargine separately. However, can we use insulin glargine in combination with short-acting insulin? Yes, it could be that insulin glargine is administered separate from your short-acting insulin. But both insulin glargine, which is long-acting, and the short-acting insulin are actually used in a treatment regimen. So once again, insulin glargine is not mixed, but it could be a part of a combination treatment regimen. Okay, so when you say it's a combination treatment regimen, these are not necessarily administered together. Okay, now let's recall our codes. Rapid acting insulin, let's remember 1563, 15 is the onset, 60 is the peak, and the duration would be 3. And then short acting insulin, our code is 32.8. Intermediate acting insulin, our code would be 1 times 4 times 4. And long acting insulin, of course, the code is 4024. Now, what is the significance of having these codes, and why do I have to learn it? Mentor Ray, why are you making it difficult for us to remember a lot of numbers where in fact the only number that we know would be our age? Okay, I feel you guys. I took up nursing too because, you know, I don't have good skills in dealing with numbers. So to make the long story short, I'm not that good in math, okay? And in nursing, during my time in our curriculum, we only have 1 math subject, and that's college algebra. I'm so glad I went through it, okay? Okay, so what's the significance of memorizing these codes? Okay, here it is. Let's apply what we learned. Suppose you have this question. The following 4 patients receive their insulin at 7 a.m. This is the question that we have a while back. Which patient should the nurse consider as a priority for blood sugar testing? If you know which among the types of insulin will have the most rapid peak of action, and what did we say about the peak of action? It's when the strongest action or effect of the insulin is exerted. So we expect hypoglycemia to occur. Therefore, that is the patient that you need to check for the blood sugar first. So in essence, your intermediate acting as well as your long acting insulin, okay, would be less of a priority than your patient who's taking your insulin. So for this type of question, the answer is actually option number 2. 30-year-old with type 1 diabetes who received 10 units of Insulin List Pro. Why? Insulin List Pro has the most rapid peak of action among the types of insulin that were mentioned in the other options. Therefore, chances are the patient in option number 2 would experience hypoglycemia or hypoglycemic reaction ahead of the other patients. Okay? So that's the significance of knowing your code. Now, let's try answering another sample question. After the administration of short-acting insulin in the morning, which statement of the patient indicates understanding of the effects of the drug? So the key word would be understanding. So we are supposed to choose a statement that's true. Let's move on. So option 1, I won't need to monitor my sugar if I am on this drug. That's false. Option 2, I will need to take this drug when I'm having cold sweats. Cold sweats is a sign of hypoglycemic reaction. So you first have to check your sugar levels before injecting insulin. Otherwise, the blood sugar could fall further. So option 3, I might need to have snacks in about 2 to 3 hours. Again, consider. In option 4, I don't mind missing my lunch as long as I am taking this medication. Miss meals when you are taking insulin could actually lead to hypoglycemic reaction. So what type of insulin is the patient taking? You have short-acting insulin. And for short-acting insulin, the peak would usually be 2 to 5 hours. So that's when we expect hypoglycemia to occur. So let's take a look at option number 3. I might need to have snacks in about 2 to 3 hours. Now, having a snacks to coincide with the peak time would be appropriate such that you prevent hypoglycemia from occurring. So the answer to this question is actually contained in option 3. Excellent. Okay, but wait. What if a question is phrased like this? Okay, let's read through it. After the administration of NPH insulin to a patient in the morning, when should the nurse serve snacks? Okay, is it 1, after dinner time, 2, within the first hour after the administration of the insulin, 3, late in the afternoon, or 4, before midnight? Now, what is the difficult thing about this question? This question, unlike the first 2 questions, did not actually have specific time frames in the options. It doesn't say whether it's 2 to 5 hours, 2 to 3 hours, no. And it's very important, since you already have mastered your codes, to try to figure things out. And look at this class. What type of insulin has the patient taken? You have your NPH insulin, which is an intermediate acting insulin. Now, remember this, okay? Hypoglycemic reaction usually occurs before meals, okay? So if a patient has taken your rapid-acting and short-acting insulin in the morning, you expect hypoglycemia to occur before lunch. If the patient had your intermediate-acting insulin in the morning, hypoglycemic reaction usually occurs either late in the afternoon or before dinner. And if the patient has taken long-acting insulin, okay, hypoglycemic reaction could occur either at dawn or before breakfast the next day. Therefore, having that functional concept in mind that hypoglycemia could occur before meals, and you know for a fact that for NPH insulin, Okay, the peak of action, that's an intermediate acting insulin, could be anywhere from 4 to 12 hours. So if the patient has taken that in the morning, chances are the hypoglycemic reaction could be in the late afternoon or before dinner, such that let's try to answer the question by analyzing the options. Is it 1, after dinner time? Nuh-uh. So it should be before. So 2, within the first hour after the administration of the insulin. Well, we're talking about that could be with reference to rapid acting insulin, not intermediate acting insulin like NPH, the one we have for the question. 3, late in the afternoon. Okay, what did we say? Before meals, right? So possible answer. Or 4, before midnight. Before midnight. Okay, so that's more than 12 hours already from the time that the NPH insulin has been given. So the best answer for this question is actually option 3, late in the afternoon. Now you have learned how to use exact numbers through coding to answer questions related to the peak of action of insulin. And you also have learned how to analyze questions that does not contain exact times that relates to the peak of action of each of the types of insulin. So what is important is you've learned either way, you know how to deconstruct the question. And that in itself is empowering. That would build your confidence if you know how to approach the question, because you learned it the way we did it. We're using functional concepts, okay? So let's move on. So we also have what we call premixed insulin, okay? Although in some instances, manual mixture of insulin, okay, are usually being done. So mixing of insulin would usually be done, but there are also types of insulin that are already premixed, okay? So this includes your Humulin 3070, which simply means 30% regular, 70% NPH, or Humalog Mix 25, which means 25% List Pro and 75% List Pro protamine. So the onset of action for Humulin 3070 would be 30 minutes. Peak of action, dual. It simply means that the peak of action of both your regular and NPH insulin should be taken into consideration. And the duration of action would be 16 to 18 hours. For Humalog Mix 25, the onset of action would be 15 minutes or less. Peak of action is also dual, which means the peak of action could be the peak of action of your List Pro and your List Pro protamine. And then the duration of action would be 16 to 18 hours. Okay, here's a functional concept. Premixed insulins combine regular and intermediate acting insulins. And premixed insulins are administered 5 to 15 minutes before meals. NPH insulin is the only intermediate acting insulin that can be premixed with rapid acting insulin. And NPH insulin is the only, once again, intermediate acting insulin that can be premixed with rapid acting insulin. Glargine and detemir cannot be mixed with other insulin in the same syringe, but can we use it as part of a combination treatment, meaning long-acting insulin like Glargine, okay, and short-acting insulin? Yes, they can be used in combination, but they should be administered in separate syringes. You don't mix it in the same syringe, okay? So let me highlight you Humulin 3070. It's classified as premixed insulin. It's effective when you have reduced blood sugar levels. And exactly what time do you have to give it? Administer as prescribed, usually 30 minutes before meals, breakfast or supper. Some would say 15 minutes before, 15 to 30 minutes is appropriate. Do not use infusion pumps when using your Humulin 3070 or premixed insulin, because your infusion pumps are usually used for rapid-acting insulins, okay? Normally, it appears cloudy and white. Do not use when it appears unusually thick, or if it contains crystals, or when it remains clear after being rolled between the hands. Do not discard the medication in the sink or toilet or in household garbage. It could potentially hurt animals, okay? And then take it exactly as prescribed. Timing of administration in relation to meal times is important. So thank you so much for learning with me about the types of insulin, there's another part of this video. I will have the link on the description box. Once it's available, it's going to be dealing with manual mixing of insulin and insulin administration. So I advise that after you study this video on the types of insulin, you also need to go through the video on insulin administration. Okay? So let's learn together. For more instructional videos, subscribe to our YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. So once again, it's shout out time. Congratulations to Usha Subedi from Nepal for passing the NCLEX RN for the state of New Mexico. She joined her classes in Nepal with Gapuz Mentors.